wellness, and the environment to update the nation on the COVID-19 situation here in St. Vincent and the Grenadines. To do that, we have the Minister of Health, St. Jimmy Prince, who will talk to Duncan. We also have in the room technical persons who will also be able to assist in any question. So there is a certain time.
Secretary Knight, Chief Medical Officer Dr. Kisa Beach, Medical Officer of Health Dr. Roger Duncan, Epidemiologist Tamara, other senior technical officers in the Ministry of Health, members of the press, listeners online and on radio. Ladies and gentlemen, good morning. I'm grateful that you have joined us at this news conference on such an important issue as the coronavirus situation in St. Vincent and the Grenadines. The last 10 months or so constitute a special period in this country. In fact, globally, 2020 can be considered our annus horribilis, or horrible year. The entire world has been turned upside down, and this has certainly been the most destabilizing public health emergency to affect us in almost 100 years. I think most of us by now realize that it is not just a health issue, but equally an economic and social one. So we must be equal to it, and we must continue to focus our national energies towards this battle, or this war, as you would call it. And since health is a shared responsibility, one expects that the entire nation would unite to fight against it, the pandemic. You will recall that from the onset of this pandemic, St. Vincent and the Grenadines has been very proactive in treating with it. We did so while trying to balance all the considerations, whether they were health considerations, social or economic, and the like. We went to Parliament and passed a stimulus package to the tune of some $78 million. And that was to cushion the anticipated social and economic fallout from this terrible scourge. Ministry of Health, Wellness and the Environment activated the COVID-19 task force on the 6th of February, that's 2020. It was chaired by the Chief Medical Officer, and as suggested, the task force included persons from the Ministry of Health, National Security, Air and Seaports, Immigration, Customs, and NEMO. Of course, all of these entities had to come together because it is indeed an emergency, and all hands had to be on deck to deal with it. On the 11th of February 2020, the global outbreak was declared a global public health emergency of international concern. And 1 month later, the World Health Organization declared COVID-19 a pandemic due to its global spread. This country also recorded its first confirmed COVID-19 case this very same day. The Ministry of Health, Wellness and the Environment has identified that the key elements to a successful response within the disaster management and risk reduction frameworks are the following. And you'll have seen that we have dealt with all of these one by one. 1, early detection. 2, testing. 3, containment. And 4, treatment. The Health Emergency Operations Center began operating from the National Emergency Operations Center on Thursday, 2nd April 2020, following the second confirmed COVID-19 case. At this level of the SPG pandemic influenza plan, the required contact tracing, quarantining, and other immediate actions, including information sharing, significantly increased. And we have been proud over the past few months to say that we have a well-managed quarantine system. We have a very good contact tracing system. We have unleashed a lot of resources in this regard, and that, I think, was responsible, and our proactivity responsible for the results that we've had over the few months. With respect to human resource, to date, over 50 nurses were employed and dispatched to the community health districts to assist with clinical assessment of persons in quarantine and isolation. An additional 6 doctors were assigned to our isolation center. The core of the task force has been working around the clock, revising and updating protocols, processing more than 200 passengers per day, monitoring our online system, both air and seaports, and the list can go on. And we are immensely grateful to these frontline people who have been at the front of the attack, or resistance, if you would like to call it that, on this particular pandemic. Our capacity to be mobile has increased, which includes support from the various ministries. We have established community and hospital health teams to monitor persons in quarantine, testing, and active surveillance. We have established clinical teams to manage patients in a clinical setting. To date, we have had no COVID-19 deaths. With respect to infrastructure, public isolation facility has been completed and can house up to 20 people. In the case of a surge, we can go beyond that, but I think the CMO will talk about that. We have expanded our lab facilities physically and its testing capacity. We intend to do more with respect to this. And recently, we have been insisting on the adherence to our mass gathering protocols. We strongly advise mask use, especially in instances where physical distancing is not possible. We have recently advised the Commissioner of Police last weekend to ban amplified music in public spaces, those settings which the public has access to. We've advised the Ministry of Education to allow screening and testing of various groups outside of the contact tracing. And of course, we advise the Ministry of Education with respect to delaying school opening for at least 1 week. We have updated our protocol for entry via air and sea based on changing situations. We have moved the BVI to medium risk, they were high risk, and then we moved Barbados from medium risk to high risk. And we have also shut down the Union Island port and the port of entry for pleasure craft, etc. So that's recently. And now we will go into another phase again. And again, the CMO and the Medical Officer of Health will inform you more as to how we intend to treat going forward, because there have been some developments with respect to an increase in cases. The total COVID-19 cases of 133. The imported cases are 115. Import-related, 6. And 33 active cases. However, cases under investigation amount to 12. We have had no COVID-related deaths, as we said before. And the number of recoveries, which is important, of course, 100. Total tests done, 21,373. Of course, we'll continue to do more testing, and we will go out of the box, so to speak, to do this testing. We won't just continue business as usual. I would, at this point, like to implore the public that this pandemic is a serious, serious issue, and we ought to treat it as such. I'd like to implore the persons who are returning to St. Vincent and the Grenadines that when we say you have to quarantine, we really mean it, and that anybody who violates this protocol will be dealt with seriously. I know there are some people who think we are not doing as good a job as being serious with the people, but we will have to up the ante in this regard. We cannot allow a few people who have no regard for the health of others to run rampant through the country. And from now going forward, we are going to take a serious look at this. The CMO, as I said, and the Medical Officer of Health will give you more information and be available to answer questions. And of course, we'll continue, whether virtually or otherwise, to speak to the public and to bring you information with regard to this pandemic. So thank you very much, and I hope that 2021 will not be as difficult a period as we have had in 2020. It becomes even more difficult. I expect that all of us to put our heads together and our hands together and to deal with it at a united front. Thank you very much.
Good morning, everybody. And this morning we are going to give you an update on the situation with COVID in St. Vincent and the Grenadines. Yesterday we announced on the 4th of January that we had recorded a total of 133 confirmed cases, 100 of which had recovered and 33 were active. Of that number, we had a total then of 12 local cases. Overnight, we recorded an additional 4 local cases, and so we are up to 16 local cases. Of those cases, we have grouped them into basically 3 clusters or 3 categories. We have 2 clusters, and the remaining numbers are individuals who we are at this time attempting to link to the existing clusters. In terms of testing, as Minister said, we have done 21,373 tests, and as we work today, we are doing further testing. We have utilized our molecular lab unit. We have expanded our testing capacity to the Memorial Hospital, where we are testing for using our gene expert machine. So the Chief Laboratory Technologist, Mr. Samuels, is actually not here this morning because he is working at the MCMH lab to work on these additional tests that we shall be doing. In terms of the contact tracing, Dr. Duncan, who is the lead there, he will deal with that. I just wanted to go briefly into some of the protocols that we have in place. So right now, the mass gathering protocol, which I must remind everybody, never discontinued the advisories for mass gatherings. Right now, we are saying 200 persons indoors, 400 persons outdoors. We stress as much as possible that persons not attempt to get to the 400 figure or 200 figure. We are asking that persons use their masks. They allow for physical distancing, turn off air conditioning when possible when you're inside the air moving. All right? In terms of the entry protocols, as of yesterday, January the 4th, we introduced phase 9, and that protocol requires that persons coming from Barbados, which has now moved to a high-risk category, that they must stay 10 days in a tourism authority, Ministry of Health approved facility, hotel, and that they must come with a 72-hour or younger test. They will be rechecked during the 7 to the 4 and released. We've also changed the management of persons in the medium category. Those persons, when they come, would no longer be allowed to go home, but rather they must stay in an approved hotel for 5 days. And then they would proceed home and complete any further quarantine if necessary. The other protocols for the low-risk categories, those persons coming with a test, they will be tested on arrival and they will remain under observation until they're cleared. We have other protocols, the bubble protocols, and just for clarification, There's a generic bubble protocol for resorts. However, each resort will adjust that protocol depending on their resources, and that adjusted protocol is submitted to the committee, and then that will be approved. As it is now, we have Mustique, Canawan, Mandarin, Soho House, and Canawan Properties, along with Becker Beach Hotel, being approved bubble resort facilities. We also have the existing work quarantine protocols, which are utilized when we have persons needing to come in for emergency services. Otherwise, we have protocols that would be adapted as necessary, depending on the discretion of the medical officer of health or myself, the CMO. In terms of capacity to treat persons, we currently, as I said, we have the Argyle Isolation Facility, and we have admitted one person there who is admitted for care and not just safekeeping. We have one person admitted to the Milton Cato Memorial Hospital for care, and that person was admitted overnight. Person is stable, and the other person is admitted to the facility, as I said, just for safekeeping. In terms of surge capacity, at the beginning of this pandemic, we already had in our possession 2 isolation tents, and we also had 2 isolation trolleys. We now have expanded that. We have now a total of 4 isolation tents and 6 isolation trolleys, so that we can safely move patients, if necessary, between facilities or from the Grenadines up to the maximums. In terms of the continued work, we are asking all pensions, all persons living here, that we continue to work together. And a lot of that is going to be compliance with the advice, whether it's quarantine, whether it is isolation, but most importantly, wearing of your mask when you are out in public. That's the only thing that's going to stop this spread. So I'm going to ask the medical officer of health now to continue in this update.
Thank you very much, Simone, Honorable Minister, colleagues in health present. Good morning to you. I think the most important phenomenon as described by Simone regards to these local cases with no travel history. And that would have transitioned us to a different phase in this COVID-19 response. So we want to talk a little bit about contact tracing and how important it is for us. If we're going to be able to stamp and reduce the number of cases, we have to know where positive cases have been, with whom they have been, when they went there, how long they stayed there, and what sort of interactions they had while they were at any given place with any given person. So far, based on these cases, we have traced in excess of, I think, 200 persons upwards, and we have done more than 200 tests. Some people have had repeat tests as part of the contact tracing. So if you get a call from the Ministry of Health, and it says that you might have been exposed to someone who was tested positive for COVID-19, first thing you do is to take this very seriously, okay? Second thing you do is to listen to the advice that's coming from the health worker who's going to be in touch with you. And the advice basically says this: you've been in touch with someone who's tested positive for COVID-19. We need you to quarantine or isolate yourself until we get to you. Please do not go to your doctor. Please don't sign in any neighbor instructions, and we'll come to you. There's quite a lot of tracing, as I indicated, based on the number of people that we've contacted and traced so far. So it might take some time, and I know we're all anxious about, knowing that I've been exposed to someone. We want to know what your status is. We know that a certain level of anxiety comes with this. But we needed to be patient for us. It might take some time for us to get to you, a couple of hours. It might be overnight, depending on where you are and when we were informed. So please be patient, but please stay where you are. If in the event that you're not feeling well, then you need to let us know so that other arrangements could be made to have you either move to one of the facilities that the CMO had pointed out earlier on, or to give you other advice. Now, we know sometimes people's social life, there are significant issues or, well, things that we consider private and personal. We want to assure the public that we treat any information you give us with the strictest of confidence. Our sole intention of getting this information is not to know about you, but to be able to stop and reduce the spread of COVID-19. And if we don't have the information, then clearly we're not going to be able to make the proper decisions. So if what goes in is wrong and what comes out is going to be wrong. So the actions we take based on erroneous information is not only going to not solve the problem, but it's also going to further endanger public health. We have been having some issues, I understand, with the COVID hotline. We ask you to bear with us. I think people have been in touch with several members of the task force who are known. So I think everybody's cell number now is known to everyone. And we've been taking calls and we've been answering these. So regarding, if you want to reduce your risk of exposure to someone who might have COVID-19, we go back to the same old advice that we've been given from day one. And every time we speak, we keep saying the same thing. Distance yourself as much as possible. If you don't need to cover it, sanitize your hands regularly and keep your distance. And these are the things that are going to keep you safe. It's going to reduce your risk of being exposed to someone with COVID-19, and it's going to help us immensely. The next couple of weeks, I think, is going to be very important for our contact tracing in terms of where we go and, how many people we're in contact with. Our goal here is to identify as quickly as possible, in the shortest possible time, people who are ill with COVID-19, isolate them, find their contacts, isolate and test their contacts also, and thus reduce the spread of COVID-19. I'll stop here and wait for questions.
Thank you very much, Minister Prince and Doctors Isa, Beach, and Duncan. Already we have some questions that have started to come in. The first one has to do with protocols for minibus. Plans for school closure is the second. And another says, what is a cluster? Does it mean community spread? I think I'll ask Dr. Keza Beach to answer that third question. The minister, the second, plans for school closure. And protocols for minibus. Duncan, you handle that? For minibuses. Then we'll have the minister on school closure and then Dr. Beach on the cluster, etc.
I know we continue to have some conversation in terms of the number of people in minibuses, but these are some considerations that all of us need to consider. If you're going to use public transport, then you make sure you must wear masks. And minibus operators should insist that every passenger who enters their bus wears a mask and have their hands sanitized. Distancing is going to be extremely difficult. It is a challenge. We know that people use the minibus to get into work and to doing, going through their basic life activities. So as far as you possibly could, you want to try to distance yourself as much as possible. But the key thing, wear a mask, sanitize your hands. And if you really don't have to take a bus that day, don't take a bus.
Okay, with respect to the issue of school closure, from the Ministry of Health perspective, the issue really the focus is really on general screening. And you have to remember too that school reopening was delayed for a week in the first instance. I know we have closed schools before. In discussion with the Ministry of Education this week, they will review the situation based on advice from the Ministry of Health. And in the meantime, of course, the last time we closed schools, we used the blended approach to learning and teaching. I think that will be in place again if by some way they're not able to reopen school. But I think they will review it by the end of this week.
Okay, so to explain cluster. A cluster is a group of persons who test positive, and they're related either by time or they're related by the geographic location of where they are or the common exposure. So, for example, as I said, we have identified at least 2 clusters where those persons either work in the same area, they congregate in the same area, or they attended an event. So we have identified 2 of those, and we are in the process of actively investigating the others who haven't immediately fallen into those 2 clusters to determine if there's any link. So at this point, the ministry is not saying that we have community spread. Rather, we are saying that we are investigating, and we have made some significant progress in terms of getting the linking, and we are going to continue to investigate and go along that way.
Okay, there's another question. Plans for mass testing. And somebody else wants to know what is a bubble resort and how much freedom of movement is allowed. So, Dr. Keith Beach, are there plans for mass testing? You can answer that. Dr. Duncan, you'd answer the bubble question. Simone, you'd answer them both? Okay.
So in terms of the bubble, as I mentioned, we developed what we call a generic protocol or generic requirements for a bubble resort. And basically what it means is that persons staying at a particular resort would be subjected to increased testing. The resort will be required to have increased resources, all aimed at keeping those persons, rapidly identifying the positive, protect the staff there. So a lot of these bubble protocols require that the staff are tested on a regular basis, that the workers are specially trained, and that the facility has the resources to properly allow persons to be at once quarantined or grouped safely in known sub-bubbles almost, and for them to move in a controlled manner within that general bubble, which might be more than one facility. So that's what the general generic bubble protocol is. And as I said, it varies per facility, per resort, depending on what their capacity is. In terms of mass testing, we have 2 levels of screening testing. So for now, if somebody is positive, we will be doing PCR testing on their close contacts. We will also doing screening to see if there's any evidence of prior exposure. So for example, somebody might be a contact and that person is negative on PCR, so that means they do not currently have an active infection. However, if we do antibody testing on that person and we determine that person has IgG antibody, which indicates that that person had some exposure, it's another clue, because it then suggests that that person might have been exposed before the current active person. So that is how we are working. So we are doing the specific contact tracing of positive persons along with the additional screening around each positive and each contact of a positive. And at the same time, we are working with certain large organizations. As you know, in St. Vincent, somebody might be working, say, at the Ministry of Health, but we are all living throughout St. Vincent. And if you screen in terms of antibody for exposure, you will get an idea in terms of where you might need to do further investigations. So it's not that we are saying everybody walk in and we will test you, but rather we have put in place that if you come to any healthcare facility as a client, right now, I expect that persons will be tested using antibodies. If you come to healthcare facility with flu-like symptoms, you will be tested. We go to certain organizations, and even today, we are actively doing that, where we are just generally screening, but within particular organizations. In terms of there was an additional question. Somebody made a question about healthcare workers testing positive, and we have to say, as of yesterday, we did have, I can confirm that we have 2 healthcare workers who have tested positive. So far for our investigations, those infections were not contracted, or let's say the exposure to COVID did not take place at the work site. They were outside of the health facilities where these workers, where they work. And it was a difficult period. We care, but as you would know, keeping our hair staff safe is an extremely important goal of this ministry, because if your healthcare staff is not safe, if they contract, we cannot take care of you. And so I'm urging everyone, I'm urging the healthcare workers, I'm urging the families of the healthcare workers, the friends, I'm urging all the Vincentians, wear your masks. Let us protect each other. The 2 workers, I am pleased to say they are stable. They are not ill in terms of having to be admitted. We are currently testing all of their contacts. For one of the workers, we were able to test all of their work contacts yesterday, and they are all negative. The other worker, we are in the process between yesterday and today of testing all of their work-related contacts, and additionally, we are testing all of their home, non-work contacts. So that's where we are in terms of the questions.
Thank you, Dr. Kiza Beach. Another question, why are we still allowing mass gatherings in such large numbers if we have cases we cannot trace to a cluster at this time? Next question, are there sufficient resources in the country to determine if other COVID variants are in the country? And the last, are the hotels that allow the breach of quarantine still on the approved list? CMO?
Okay, so in terms of the mass gatherings, as you know, because of the ban on amplified music, that ban, in effect, stops all of those big party gatherings, okay? The only other mass gatherings, inverted commas, that are ongoing would be, strictly speaking, your church services. And we have spoken with the different members of the faith, and we have advised, as before, if your church does not allow for sufficient spacing, or rather the other way, if your church allows for only 20 people with proper spacing, that's the number you should have. You should pay more attention to wearing of the mask for the churchgoers, not using your air condition, so you open doors, sanitizing, and better to know who you have. A very disturbing sight, I think, was over the weekend when we saw smaller liming spots continuing to form without masks. And I am pleading again, we are pleading, as Dr. Duncan said, we are doing contact tracing. Contact tracing requires that you know who you are with, who is in your facility. We are urging, according to mass gathering protocols, you are supposed to be registering at least one person from each group, each party group who comes to line, so that when somebody turns up as being positive and haven't been in your establishment, you will be able to say, okay, these are the people we need to focus on. Some persons, the persons who have bad hair and a bad hair, it might be inconvenient at the beginning, but it's something, you were to find that somebody was in your establishment who is positive or something, it would be easy and it would be to track that person. In terms of supplies, the major challenge right now in terms of supplies are the testing supplies. The swabs that we use, the testing in the labs, that's our major challenge. Over the weekend, we received some resources from Tahoe. Tomorrow, we are going to receive some additional resources through the ACS from Brazil. But we all must be aware of the fact that globally, there is a major challenge in terms of resources for testing. But as of now, we have sufficient, we have on order, and we are going to continue to be very strategic in the way in which we use these resources. In terms of facilities that do not comply, over the last 2 weeks, we have removed 2 facilities from the list of approved hotels because of reports of non-compliance, especially in terms of being allowed to visit. So 2 facilities have been removed, and we have given instructions to the teams before last week. We are giving instructions to the teams to do a review of the existing facilities and to remind proprietors of the importance of sticking to the protocols. If we have other facilities, properties where we receive good, strong evidence of them not complying, they will be removed. Okay?
Okay, somebody's asking, will there be specific headlines for various sectors such as churches, manufacturing, etc.? I'm not too sure I understand what is meant by headlines. And somebody was saying that in Tobago, they have stopped receiving genes for their machines. Can the Ministry of Health assure supply of genes tests to continue testing via that means?
I'm not too clear, sorry, on the question about the headlines. But as it is now, the generic mass gathering protocol gives you basic guidelines. I just want everybody to remember basics. Keep your space. You should have ideally 6 feet around you. If you can't do that, people too close to you, right? You should wear your mask. You leave your windows open. You should clean your hands. If you don't have to be, if you're waiting on a line, so for example, a lot of the business places, they're limiting the number of persons you can have inside, and so persons are required to wait outside. Just be clear when you wait outside that you maintain your space and you wear your mask. There was something that, a question that I didn't answer about typing. So 2 weeks ago, we submitted to CAPA, the Caribbean Public Health Agency, the lab there, because there's a project which allows for the typing of the coronavirus to see if we had that variant that everybody's speaking about now, the variant which is much more easily passed on to persons. And we submitted samples to CAPA, and yesterday we got the results that the samples we sent did not test positive for that new variant. However, we are going to send some more samples to continue testing for that variant because we are extremely suspicious about the recent developments here. We went from a relatively steady pace in terms of number of cases to between the period of the 10th of December to the 17th of December, we noted, and even before that, we noted more of our imported cases coming from the United Kingdom. And then we had the major spike following the 17th of December. So we are sending samples to the CAPA Public Health Lab to be tested to see if we do indeed have the variant strain here. Yeah.
Hello, good morning.
Thank you, Doc. We are waiting on, I think, Kenton Chance wants to join us.
Yes, I don't know if you can hear me. Can you hear me?
Yes, we can.
Yes, good morning, everybody. My name is Kenton Chance of Eyewitnesses in the Caribbean Media Corporation. I have a few quick questions. One of the things I'd like to know, the number of persons, I would like to know the number of persons in each of the 2 clusters and how many persons are outside of those 2 clusters. That's one question. I have a few. I don't know if I should ask them all at one time.
You do that now.
Okay, so the question is that NEMO announced last week that the commissioner had announced a ban on amplified music in public places and the places to which the public has access. And it's the circular specifically mentioned churches. I want to know too if the Ministry of Health is satisfied that churches adhered to that ban. Also, so Vincent and Grenadines, we are part of the Covet mechanism facilitated by PAHO. Can you say how many vaccines will be available to citizens and what is the ministry's strategy for the vaccine rollout? And finally, at least, considering the imminent threat of the last volcano, evacuation may become necessary and people may be housed in shelters. What additional measures has the Ministry of Health put in place to mitigate an outbreak in shelter settings?
Okay, thank you, Kenton. Who is coming first to respond? Dr. Kieser, please.
Okay, so in terms of the clusters, one cluster has 7, another cluster has 5, and the others that we are working on, well then, if you think we have 16 in all, so 7 and 5 would be 12. So then we have the others 4 that we are still working on in terms of finding link. So that was the numbers in the clusters. The other question, Chance, was in terms of the churches. So the churches, I think from reports and from the queries coming from the churches, they are attempting to comply. As always, you will have some outliers, but in the main, they are extremely concerned and they are trying to do their best in terms of complying. I know one reverend said to me that he was going to inform the congregation that anybody who had been sick, anybody who wasn't feeling well, anybody who had a relative who had come in and then they felt unwell, that they needed to report it immediately to the task force. So I think the churches are working with us, with Vincentians, to try and control this. The third question was the COVAX. Okay. So yes, St. Vincent is part of the working with PAHO and the in the COVAX facility. As it is now, we are still aiming to have the vaccines, which will be made available to us here in the first quarter. We had a meeting yesterday with CAFA, PAHO, in terms of seeing what is available and as an update. As you know, with the COVAX, which vaccine we will get has not been determined. COVAX allows for the for access to all of the vaccines that are available, most of them. And the ones we will get in St. Vincent will depend on the availability. It will also depend on the characteristics we ask for. We are asking for sufficient vaccine to immunize 70,000 Vincentians, basically 70% of our population, which is 70,000 Vincentians. Under the COVAX facility, sufficient vaccine for 20,000 Vincentians would be given to us free of cost. That is the intention, though I must caution that as yet the COVAX facility has not been able to get all of the funding they need to be able to meet all of the commitments they have made. They are still seeking funding. Their goal is $5 billion. So for now, St. Vincent is going to get 20,000, and we are going to buy as a country with funding from different agencies, local funding, an additional 50,000, sufficient for 50,000 vaccines. That is the plan. In terms of rollout, we have already started working with our healthcare providers. We are seeking to contract a consultant to do the most important part, which is the communication, which is the letting persons understand what is happening, how it will happen. Luckily for St. Vincent, as with most of the OECS countries and CARICOM countries, we have an excellent primary health care system, which allows for efficient delivery of vaccinations as we know it. Granted, that's a vaccination system that is targeted mainly towards children and school health program. Anticipate in terms of some of the challenges we are seeing in some other countries, that we would have that challenge in the rollout. We are in the process of procuring the ultra cold vaccine fridges to keep a place. So in terms of the procurement, the storage, and the distribution, those are things that we are working on already, and we anticipate we should have it fine. Our greatest challenge, we acknowledge, would be the uptake, because we do not, at this point, intend for it to be a mandatory thing, but rather a voluntary. And we're asking Vincentians to get the information from credible sources so that they'll be willing to take the vaccine when we have it, and it will be free of cost. La Soufrière. So the Ministry of Health, Wellness and Environment has a multi-hazard disaster preparedness plan. And during the hurricane season, we had made adjustments to our hurricane response plan to accommodate COVID, because in the hurricane response plan, we have to cater for persons being in shelters. So we made the adjustments to the plan then. Granted, in the case if there were to be an explosive eruption rather than what is going on now, some of our shelters we could not use. Those in the red zone. But we have already put in place in terms of what we will do and measures we will take to protect persons going into shelters during this COVID time. But we are very aware, and that's another drive for us right now to lock down this local spread that's going on and finding who is out there, is that we want to get this controlled in the eventuality, so that in the eventuality that we do have need to put persons in shelters, we would decrease the risk. But even so, we already have put things in place where we would do testing, we would do screening, we would ensure that persons are kept within their family bubbles, and we would do, as is with anytime somebody is in a shelter, we have daily checks with our healthcare staff, and we are working closely with you to ensure that if we had to move to shelters, we can manage it safely, even during COVID.
Somebody wanted to know how many ventilators the Ministry of Health has, and has there been a reduction in quarantine days from 14 to 10? I think that's a very important one to answer. And finally, will any sector be closed if clusters continue to emerge and our healthcare workers caring for COVID patients allowed to quarantine as a safety precaution before returning to their families? That's as far as the questions go. So I don't know who would answer those last two.
Good morning again. So the quarantine period has been reduced from 14 to 10 days. Now remember, this is not this is a very dynamic, changing situation. This is a very real change. Persons might have noticed that upon entry that you're given an order that speaks to 14, but that's order that we had in stock that we had to use then, and that will be corrected as of today. So that's what's bear in mind, that those 10 days would be spent in an approved facility, and you'll be tested on day 8 of that stay. Regarding ventilators, I think we have in excess of 25. In excess of 25 ventilators. But think about it though, is that we really don't want to get there. All right? And that is why we're trying to do all of this, especially contact tracing, arising from these clusters that we need to do to ensure that we really don't have to ventilate people. Of course, when we begin to ventilate, there's additional risk and so forth for healthcare workers. And let some more healthcare workers we probably have to take out of circulation, out of the regular work, because they're caring for people who are on ventilators, because it becomes a little riskier for the staff. Well, the understanding is this: all our healthcare workers, even before SARS-CoV-2 now, when we had SARS, when we had influenza, when there was Ebola and everything else, our healthcare workers are highly trained in terms of being able to protect themselves, okay? And they have access to training as well as protective, personal protective equipment. If there's any breach of any part, then a healthcare worker thinks that I might have been exposed to something, immediately the rules, you inform your supervisor, a report is made, and you are entered into isolation until your exposure and consequence of that exposure is being evaluated. I hope that answers that question.
Thank you very much. We'd just like to say a very special thank you to all who joined us for this very important discourse. Special thank you to all the persons behind the scenes, to our technical team, and to all who made this possible. Thank you and have a good evening.